Good. My name is Cassandra Nichols, and I am I'm in LPN class 154. I am doing my nasogastric video. First, before coming into the room, I will review my patient's chart to make sure there aren't any allergies to the equipment that I'll be using, which will be the latex. I would check patient's medications to make sure patient isn't on any medication that would interfere with the procedure, such as like blood thinners. I will check different medical diagnoses the patient may have, such as chronic nose bleeding or deviated septums or head trauma, because I don't want to, I have to be very careful because the patient's anatomy may be different than a regular patient. And also I would check patient's surgeries to ensure that they haven't had any bariatric surgery, because their stomach will be different than any other patient, and I wouldn't be doing this procedure. The equipment that I'll be using is my stethoscope, my pen light, gloves, emesis basin, syringe. I will have a glass of water for the patient to drink while I'm doing the procedure, tongue depressor. I have my tape prepared over here, my pH strips, and my lubricant, and of course my equipment for the procedure. So I will knock on the door, close drapings to ensure privacy, perform hand hygiene. I will introduce myself to the patient. I will check my patient's name bracelet and make sure their name and date of birth is correct. I will also verify with the patient any the same things that I reviewed in his medical record, his allergies, different diagnoses that will interfere with the procedure and surgeries. I will explain my procedure to the patient, let the patient know that I'm going to be putting a tube down his nose. It will be uncomfortable. You may gag, but if the pain is just unbearable, then raise your hand. Please do not flinch back, and I will pause or I will stop. I would perform hand hygiene, put on my gloves. I would ask the patient, I would test the patient's, assess the patient's cough and gag reflex by putting a tongue depressor down the patient's throat to make sure they're able to gag. I would do my patient's vitals and check their pulse, their oxygen pulse, to make sure that it's at an appropriate level, and so that I can check their baseline and make sure everything's okay after the procedure. I'm raising my patient up. I'm going to raise my patient up as far as the head of the bed as straight as possible, so that the procedure can be as easy as possible. So I'm going to put my patient in a 90-degree angle. If possible, I would have someone come in to assist me to hold the patient's cup. My patient is pretty coherent, so they're able to hold the cup on their own. So I will put this aside. Then I would prepare my equipment for the procedure. Make sure my tubing is closed, so when I insert it, nothing comes out and doesn't make a mess. I would add my lubricant, 2 to 3 inches on my tubing. Before I do this, I would measure the tubing. I will start at the lobe of the ear to the bridge of the nose. Then I would go down to the patient's xiphoid process, and then I would mark it with tape or a marker. It's at about 55, well 56. Then I would lubricate it. Then I would have my patient sitting straight up. I will put this down so that I'm able to perform this to the best of my ability, so I'll get comfortable, get everything on my way. I will hold my patient's head to control movement. So I will start with my patient head straight, inserting tube down in the nostril, pointing downward so that I don't go into the brain. My patient would have the cup of water, and as I advance the tubing, I would have my patient swallow. As I'm pushing back, I should feel a resistance, indicating that I am at the back of the patient's nose. Then I would have the patient do chin to chest and continue to go downward. As I'm advancing during the whole procedure, I would have the patient drinking the water and swallowing every time I advance. I will keep going. And also, during the procedure, I will make sure the patient's okay. Make sure that the tubing is going down and not up by looking inside the patient's mouth with my pen light. Sometimes you will see the tubing in their throat, sometimes you won't. If the patient does any type of different voice changes or anything like that, you are in the wrong area. So patient is doing well. I am continuing to advance my tubing. Patient is still tolerating and swallowing. Tubing's almost advanced to where it needs to be so that it is in the stomach. Normally it wouldn't be this much resistance. If it was, I would stop, because this may cause pain in my patient, discomfort to my patient. So it's where the tape is indicated. I will not let go of this. I will put my temporary tape on the bridge of my patient's nose and the tubing to keep it in place. I would then listen and take my syringe that I filled to 30 mils. I would close that off so nothing comes out, and insert the syringe. I'm listening in the upper gastric area, and I'm listening for a swoosh sound. If I hear a swoosh sound, that means that I'm in the right location. I hear a swoosh. While my syringe is in place, I will pull back about 5 mils or 10 mils to get some of the gastric content and test it to make sure that I'm in the correct area. Close this off so that nothing comes back. I will close this back. Place this into my container, my emesis basin. I will test it to check its contents. If I'm in the gastric area, then it will be acidic, which will be about 3. The contents are acidic, so I'm going to leave it in place. I prepare my tape, and I've made little pants legs with it. So I'm going to put this right here while taking the temporary tape off. Put that over there. I'm going to go opposite directions. I would mark again where the tubing is inserted so that I will be able to see, since I've covered up the tape with my new tape. Then I would either hold my tubing in place on my patient's cheek or his gown. Then, depending on what I'm using the tubing for, it will either stay closed or be attached to suction. But I won't use it until it's verified by an order placed by the doctor after the x-ray to ensure that it's in place. I would clean around the area, perform oral hygiene. I would make sure my patient's okay, ask if they have any questions. I would lower the bed down to the lowest setting, raise my side rails, put the hall light in place so that the patient can reach me if needed. Then I would take my gloves off, perform hand hygiene. I would record the type of equipment that I use, the size of the tubing, the measurement of how much I place inside of the patient, the contents that the gastric contents, I would record that. I would record the patient's reaction to the procedure. I would remember to inform the doctor that the procedure is done and to make sure that an order is placed for an x-ray to make sure that it's placed correctly. And that's it.